Hey guys, let's dive in to the exercise recommendations for heart health. So if you are here live, go ahead and say hello. Let me know that you're catching this live. If you are catching it on the replay, just let me know that you are able to see it. And if you have any thoughts throughout this live, share them below. If you have additional suggestions or questions, let me know. This is a great format for us to chat and get more information out to each other about exercise recommendations for heart health. All right. So to begin, I think it can be really helpful with talking about the 14 biggest benefits for physical activity. So I want to chat through these really quickly before we get into the exercise recommendations for heart health. So big thing to keep in mind is one of the first things people will experience when they are actually increasing physical activity on a regular basis, they are going to see improvement in their sleep. They're also going to see improvements in their energy level because we know that it actually helps with basically filling in the need for our neurotransmitters. So we get a lot of those feel-good endorphins, but then we also are really getting the cortisol pieces taken care of. So if we're high stress and we're increasing physical activity, that can help bring about sleeping better and just clearing out any bad juju that we have in the day. So increased physical activity can improve sleep and improve our energy level. We also know that regular physical activity can reduce our stress. It improves our mood by reducing anxiety and depression. It also improves brain function, increases our muscular and bone strength. It also improves heart health, which is a big thing that we're going to be talking about today, and it reduces the risk for heart disease and stroke. Regular physical activity also does help with weight maintenance, and if you're doing enough of the physical activity, it can help and assist with healthy weight loss. So that is another thing to consider. It also reduces the risk of 8 common cancers, including colon, lung, and kidney function. It also reduces the risk of disease such as diabetes, and it also improves blood glucose for those with diabetes. We also know that it significantly can improve heart-related labs, so we'll be talking a little bit about that more. And it also reduces pain. In addition, if we are increasing our physical activity, it can help with fall prevention as well. And then the 14th benefit is increasing flexibility and injury prevention. Excuse me really quickly while I take a sip of water because I have a little frog in my throat. Ooh-wee. Thank you for your patience with that. All right, so again, just kind of coming back around to there are so many health benefits to physical activity, and it is really important that we are getting regular physical activity for our general health, for our mental health, for our physical health, and overall well-being. So let's talk about what the types of physical activity that there are out in the world and which ones are going to benefit our heart health the most. So I'm going to start with the physical activity pyramid and just generally share an overview of what the physical activity pyramid is. It breaks down the different types of physical activity into different levels. So level 1 is focusing on everyday physical activity. So if you're thinking about how can I be more active on a general daily basis, this is a great place to start. So this includes strategies that we've heard really commonly, such as taking the stairs instead of the elevator, parking further away at the grocery store, taking breaks from sedentary time. So if you've been sitting at your computer desk for more than 30 minutes, the goal is to try to get up and move your body a little bit more. So level 1 is everyday physical activities. Increase your physical activity through really creative ways of thinking about that. So ultimately, 5 to 7 days per week, we do want to increase our daily activity, and that can just be moving our body more. Level two is going to be the next step up, and this is where we're focusing on aerobic and recreational physical activity. So just to give you an idea of what aerobic means, aerobic physical activity means that you are increasing your physical activity to a level that is going to increase your heart rate, but you're going to be able to sustain that physical activity for a good duration of time. So it's not going to be a short duration, it's going to be doing a physical activity for a longer duration of time, because aerobic activity, it means that it is with oxygen, that you're going to be sustaining that physical activity and your heart rate will be elevated at that time. This is a great physical activity for supporting cardiovascular health because, as we know, our heart is a muscle. So if we are moving our body more, that is going to strengthen our heart that is a muscle. The other type of in level two that is the physical activity we'll talk about here is recreational activity. So recreational activity is going to be things like group sports that you can think of. So that can be things like soccer or basketball, softball, things like that. And what you'll know with these types of physical activity is there's going to be times where you're going to be active for a quick bout of time, but then there is going to be times when you're less active. So your heart rate isn't going to be sustained at a certain level for a certain length of time. It's going to be up and down throughout the type of physical activity that you're doing. So that is going to be recreational activity. The suggestion for level two is trying to shoot for 3 to 5 days of moderate to vigorous physical activity, which on average is going to be about 150 to 300 minutes of physical activity per week. And that's going to be, again, in that aerobic or recreational activity range. So I hope that's helpful. Let's cruise on to level three. So level three is going to be different types of physical activity as well. Level three is going to include leisure activity, flexibility, and strength training. I'm going to focus specifically on strength training at this level because it is becoming more and more popular, and I love this so much. So we know that strength training can have so many benefits, and we'll talk through some of those benefits here in a little bit, but I want to talk first about what the recommendations are for strength training. So the recommendations for strength training per week is shooting for 2 to 3 days of strength training throughout the week, working towards muscle overload, meaning that you aren't able to continue that exercise because you have overloaded the muscle and it is fatigued to the point that it can't continue for that short time. So the suggestion is, again, 2 to 3 days per week, and then shooting for 2 to 3 sets of 8 to 12 repetitions, doing 8 to 10 exercises that are covering your whole body. So those are things to consider when you are increasing your physical activity to include strength training. So with strength training, it is recommended to talk to a trainer before you get started, have somebody show you how to do the exercises because there can be a lot of nuances when it comes to strength training. I do like to recommend that folks start with using machines if they've never done any sort of strength training before, because they can actually increase their confidence a little bit. The machines, you can, adjust the settings and it's not so intimidating as free weights might be. But if you do really want to try free weights, definitely getting some guidance and some coaching can be really helpful for folks. So that is an overview of level three. Level four is sedentary activity. So the recommendation for this is limit sedentary time. The goal for this is to limit our time that we're watching TV, videos, sitting at a computer, or sitting for more than 30 minutes at a time. Again, just to reinforce, if you are sitting for 30 minutes or more at a time, the suggestion is to try to get up and move around and make sure that you're coming back to increasing physical activity on a daily basis, which is that level one of the physical activity pyramid. So I wanted to start there with going through what the health benefits are for physical activity, talking about the different types of physical activity, and then really talking about the specific exercise recommendations for heart health. Now, I know that I covered aerobic and strength training already and talked about a general overview for those. What I'd like to dive into next is really talking about the exercise recommendations for anyone that may have high blood pressure. Now, as always, if we are increasing any sort of physical activity, it is really important to talk to your primary care provider or your doctor to make sure that you have been approved for physical activity before you start. It's also important, if you do have an accountability buddy, that you can actually have your patients check in with an accountability buddy, and you might be that accountability buddy for them as well. And working on creating a structure that supports consistency. So as we know, consistency is the most important thing when we are creating change. And it doesn't have to be a huge amount of change. It can be really small, little incremental change throughout the week. So just to give you an idea, what the recommendations are for improving heart health or basically high blood pressure in folks is increasing physical activity, specifically for aerobic activity, to at least 2 to 3 sessions of moderate intensity physical activity. That means things like brisk walking, riding a bike, swimming, or doing water exercises where your heart rate will be elevated, but not to the point where you're so fatigued that you can't sustain that activity for very long. Now, again, the recommendation is 2 to 3 times per week to start, but ultimately what we want to shoot for is trying to get more active on a daily basis. So if you can shoot for 2 to 3 days to start, starting with short durations, and then increase the frequency of short durations to, let's say, 5 days per week before you start increasing the time that your physical activity is scheduled for, that can be a really great strategy. So to repeat that, for aerobic activity for high blood pressure, the suggestion is to start small. Shoot for 2 to 3 sessions per week of moderate physical activity, and that can be brisk walking, swimming, cycling, or bike riding. And again, shooting for a short duration on those days. Ultimately, what we want to shoot for is shooting for at least 20 to 30 minutes most days of the week, or anywhere between 150 minutes to maybe up to 300 minutes of moderate intensity activity per week. But again, start small. Now, for folks that are wanting to incorporate strength training, this is a great strategy to include and combine the types of physical activity because we know they're really beneficial for both. So for strength training, the suggestion is to start with 2 to 3 days per week and rest in between the days where you're doing the work. Now, if you know why that is the case, share your comments below, but it is really important to split those times up and for the specificity of allowing your body to recover, right? But if you have more details on that and you want to share that, please do. That's really important. So what the goal is for strength training is shooting for, again, the 2 to 3 sets of 8 to 12 repetitions of 8 to 10 different exercises that are covering your whole body. So doing a whole body circuit 2 to 3 times per week and shooting for 2 to 3 sets of 8 to 12 repetitions of each exercise. Now, as always, you want to start small, start light, and progress to heavier, because if you are doing too much work too soon, it is going to lead to really a lot of muscle soreness. And when folks are sore, they're not going to want to continue to increase their physical activity or continue with it. So keep that in mind. All right. So overall, I hope that that is helpful in talking through what the exercise recommendations are for heart health. And you can use these recommendations as a dietitian in your practice just to give you some support. There is a resource out there that was developed by the Academy and the American College of Sports Medicine and Exercise is Medicine that walks dietitians through the exercise recommendations toolkit, and I'll share that link below if you're interested in taking a look at that. But I do hope that this has been helpful to talk through the amazing health benefits of physical activity, the different types of physical activity, and then getting into a little bit of the specifics of what can improve heart health if somebody does specifically have hypertension or high blood pressure. What are some things that they could consider talking to their doctor about if they would like to move forward with that? All right, everybody, please drop any questions, comments below and let me know what your thoughts are on this live today. And I look forward to hearing from you. Hope you have a great day and have a magical week ahead. Talk to you soon. Bye-bye.